was the first pregnancy for both of us, and it was really fun to have someone to go through that with.
Layla and Erin worked at the same policy research company. Erin's specialty, health insurance. You are something of a health insurance expert.
Something of it, but there are many, many facets and nuances to health insurance.
While pregnant, they shopped around together for the right doctors and hospitals.
The main concern actually was finding the hospital that was in our insurance network, because we both had the same insurance through our company.
They both settled on the same hospital and waited for their delivery dates. Layla went into labor first.
When the pain started to get pretty unbearable, they asked me if I wanted an epidural, and I said yes. So the anesthesiologist came, gave me an epidural. A few hours later, my son arrived.
How about for you, Erin?
They put the epidural in around midnight or so. And then the next morning, had a really, really long delivery.
Was it your feeling that your insurance company was going to be paying for the vast majority of this?
Yes, that was my understanding.
But a few weeks later, Layla received a bill from the anesthesiologist for $1,600.
I remember telling my husband, this seems really strange. Why would I get this big bill? But I didn't want to get reminders and have it go to collections if I tried to figure out what was going on. So I just paid it and thought, I'll figure this out later.
Did you tell Erin that you had gotten this whopping bill in the mail?
I said to watch out for a $1,600 bill, and she was pretty surprised.
Why were you surprised?
Both of us actually had the epidural put in the middle of the night. And who's going to stop and think to ask the particular doctor or anesthesiologist that came into the room, excuse me, are you on my insurance before you do this to me, because I don't want to get a big bill in the mail.
Erin never got that bill, even though she went to the same hospital, had the same insurance. Her anesthesiologist was covered. Meanwhile, her friend was stuck having to call the insurance company.
And they kind of did a little digging and then said, oh, it's because you chose an out-of-network provider when you were in the hospital. And I explained, I didn't choose anything. I was in labor, and this is for getting the epidural. And the woman on the phone, she kind of just kept repeating, you chose an out-of-network provider.
Did it sound like to you in that conversation that she was using the language she's told to use when someone calls in with a crazy bill?
Yes, exactly.
You were getting a kind of formulaic response.
Yes.
It took several calls and plenty of frustration, but Layla eventually got her money back, something that doesn't always happen.
I had no idea that out-of-network providers could be in an in-network hospital. I thought if you chose an in-network hospital, everyone in the hospital is in-network.
When people do their due diligence and they still get stuck with some of these crazy bills, that's a failure in the system to protect consumers and help them understand what they're facing.